So, Josh, share with us, what are these current threats that primarily in rural Oregon we have to be worried about, but then also what are the opportunities?
Terrific. So I think the greatest existential threat probably happening is from the Oregon Health Authority, and is an effort to get rid of this thing known as the prioritized list. So effectively what that was when we created the Oregon Health Plan, we said, hey, let's just rank from the highest to the lowest. What is the most effective, least expensive treatment you can do, down to the most expensive, least effective treatment at the bottom. We'll create a list, we'll prioritize how those are, and then we're gonna draw a line. We're gonna draw a line and say everything above that line is covered and everything below that line is not covered. And the idea was that, in essentially getting back to the Iron Triangle, all other states, what they do is they cut that Medicaid funding, right? So they basically cut that Medicaid funding, they reduce the amount of access to providers, or they just kick people off the plan and then they end up on the plan when they're super sick. So the prioritized list created this process to say, no, let's just cut services, and just so that more people are getting access to something as opposed to just some people getting everything and some people getting nothing. The OHA is actually trying to get rid of this. And if you ask the Oregon Health Authority, I think if you ask 4 people inside of them, you get 5 separate answers on why they're doing it. But it's legitimately an existential threat to the ability for us to be able to manage and push forward long-term sustainable funding for our rural providers that are out there. But I'll also say we actually do have some opportunities to help tell a story back to the federal government and to the state as a whole, that we are maximizing those dollars to the best ability possible, that we're managing these funds. We're not just giving everyone everything. We're actually being thoughtful and intentional about how we can help the most people. And I think when you're looking at government accountability, which is what is coming from the federal government, this is an opportunity for us to demonstrate where Oregon has been a very good steward of both our Oregon tax dollars and the federal tax dollars.
Dan, what are your thoughts?
Well, when I first started doing this, or I guess it was the 19 to 21 biennium, perhaps, we were surprised when the number of FTE at the Oregon Health Authority went from 3,000 to more than 4,000, and then in the latest biennium it jumped another 1,000. So I believe there are now more than 5,000. And like I said before, dedicated public servants, many of them are providers at the state hospital, so those ones don't count. But like, the fact is we have like 10 OHA staff looking over the shoulders of every one employee that we have actually delivering the benefit. And this over-regulation, as I would call it, is totally choking out the ability for our local community to innovate. And you really do need accountability and transparency. Totally support that. Our audited financial statements are available online. Our board meeting minutes are online. And in fact, we have public comment at our board. There's a lot of good reasons to have accountability, but we cannot have over-regulation. Just in 1 year, CCOs each have more than 200 deliverables that are due to the Oregon Health Authority. A lot of the data for those actually come from providers. So when you hear providers, complaining or expressing the problems about so much administrative, bureaucratic process, sometimes they say from the CCO, but like oftentimes in 9 out of 10 cases, it's the OHA asking us, hey, tell us every little widget that happened at each provider office, and then we have to go ask them, and then we turn it in. So what I would ask, and what might be an opportunity, is let's ask the OHA what is happening with the data that we're getting, and how are we using it to make the care better or make the system work better for the people who are using it. And I would like to just thank all the elected officials in the room, particularly in the legislature, who have worked with us and to ask questions like that of the health authority and other partners, and to ask to hit pause sometimes when we're going down a road on things like what Josh talked about the prioritized list, and say, why are we doing this now? Why are we doing it this way? And what are some other things we could consider? And I'll just say one more opportunity before I forget is, I think that the current administration in the White House has got an attitude of shake things up and really question the system. And I think there's an opportunity to do that in Oregon, and also to take our success story nationwide and to really say, this could be a model for the other states. We can learn from them. I think they could certainly learn from us on how we're saving money and keeping people healthy, which is what we ultimately need to be doing.